Well, one of our key priorities is around promoting a compassionate approach to mental health. So we will be producing a toolkit for use by teachers. So that's about a compassionate response to each other and to young people who come to them who are distressed. So we're going to be promoting that, and we've also just produced our work on school exclusions. So we will be promoting that, and also hopefully having an influence on the loneliness and isolation agenda. Okay, I mean that's a really big question. I think one of the big issues for us is the availability of services to people who are in need of them. So, waiting lists, things like access to talking therapies, having that much more available would be really important. So, a number of people obviously need urgent treatment, and the way in which they're treated and the way they're responded to in the health service is vital. So I think one of the key things is training for first responders, so that they have a confidence to be compassionate, to know how to respond to someone who is feeling suicidal. So that might be emergency services staff, it might be people in the emergency department themselves. So it's taking forward the strategy on suicide and self-harm prevention in a really practical way, and training is one of those things. Well, I think it's absolutely critical. So, mental health issues are part of a much wider picture. And if you take schools, for example, because it's probably quite helpful to look at schools. So schools have a great deal to do with the mental well-being of the young people who are in them. One of the things that we would like to see is an understanding that developing the emotional literacy of young people is an important part of what needs to happen in school as a given. So as a given part of the new curriculum. If young people were learning to talk about emotion, learning to name and recognise emotion, it's actually developmentally really positive. They also, you also learn about how to measure how you're feeling, to recognise increasing levels of distress, and therefore to know that you need to go and talk to someone. So I think that's a kind of alignment, if you like, with the bigger picture, which is about prevention of mental ill health, and people knowing how to seek help when it does happen to them. Today's conference has been full of amazing information, really, really interesting, and I think, I look forward to sort of going through some of the data in a bit more depth, because I think the reports I want to go and read. Highlight for me was Dr. Andrew Hyder, because he was talking about the human aspects of providing care and of creating change, of changing systems. And I think his reference to thinking fast and slow, to our two systems of thought, was really helpful, because we need to treat people and ourselves understand that we're all humans, and we're going to respond better to some things than to other things. So I think that was incredibly helpful and very wise.